Hello there and welcome. We got a great question that was sent. In fact, I was going to pull it up for you all today. We got a great question that was sent to me and I just wanted to jump right in and do a live on it tonight. This was the question. It said, I was hoping you could ask a question about FND, specifically how you typically treat the non-epileptic seizures. If there's anything helpful you have found. Well, yes, we have, and so has the research. So this is what we're going to talk about tonight. Thank you for the great question, and let's dive in. By the way, my name is Julie Hirschberg. I'm a neurologic physical therapist, and I'm the owner and founder of Reactive Therapy and Wellness. It's a neurologic rehabilitation facility in the Los Angeles area. And we work with a lot of folks with functional neurologic disorders, and we train and mentor a lot of clinicians, PTs, OTs, psychologists, speech therapists in functional neurologic disorders. And in fact, I am going to Combined Sections meeting. This is a big physical therapy conference every year. I'm going to this week. It's in Boston. And I'm talking with my colleagues from Mass General Hospital about functional neurologic disorders and about this idea of regaining a sense of control, actually. It's part of the optimal theory of motor learning. Autonomy is a big part of this theory of motor learning. And this is the part of the presentation that I'm doing. So this question lined right up with the literature I was reading for this presentation. So it was a win-win-win. So I'm going to touch on one of the key articles that came out recently and talks about this change in sense of control in folks with functional seizures. But before we get to that, I actually want to talk generally about how we would approach somebody with functional seizures. And to be specific, this person asked me because they have a functional neurologic disorder with gait symptoms and speech symptoms and a few other things, which were getting better. This person was managing them on their own, but the seizures were still happening frequently. And one of the things that I've definitely seen is, first, people can have multiple symptoms. So they might have functional dystonia and functional seizures, or functional weakness and functional seizures. They can happen at the same time. And sometimes what's helpful for one is not as helpful for the other. So we can see that people maybe can respond really well to some motor control training for their gait, but that's not helpful for the seizure. So when we talk about treatment and management of any kind of functional symptom, we think of this pie chart. So if you can imagine a pie chart, it's got all of these different slices. And these are the pieces that we know from the literature can be contributing to functional symptoms. They include motor control. They include the sensory system, the autonomic nervous system, lifestyle pieces, psychosocial pieces, and physical impairments. When it comes to functional seizures, two of the biggest pieces that we see and two of the biggest pieces in the literature are related to the autonomic nervous system and to, I'm doing this because this is a pie slice in my mind, the autonomic nervous system and the sensory system. So the number one thing I would suggest if you're having functional seizures or you're working with somebody with functional seizures is that you should absolutely assess the autonomic nervous system and the sensory system. Number one. And so you can't really go into treatment without assessing it first, right? So I'll give you a few examples. Let's start with the autonomic nervous system. So I would assess heart rate variability. That would be one of my first things. We use the Leaf, but you can do this with a polar heart rate monitor and a few other devices. So I would test heart rate variability. I would look at what happens with heart rate variability when we do different treatment strategies to address the autonomic nervous system. So for example, I might look at heart rate variability response to breathing. We might do a box breath or an extended exhale or paced breathing and look at heart rate variability response. Now, in addition to heart rate variability, I might just look at heart rate. I would look at somebody's blood pressure. I would screen for signs and symptoms of POTS or postural orthostatic tachycardic syndrome. We do this with an active stand test. So for this person, by the way, such a great question, I would advocate to the clinician that you're working with, if you haven't already, to test out all of the autonomic nervous system. Because once you test it, that will drive where you would go with treatment. So that's number one. Let's talk about the sensory system. So one of the things that we can see with a functional seizure is almost an accumulation of sensory inputs that really put the nervous system, the brain, into overdrive, and almost that it needs somewhere to go. And that can occur, that's not a technical term, by the way, but that can occur with a functional seizure. So, for example, we work with a lot of kids and teens, and they may have autism and functional symptoms. And so they may have some sensitivities sensory-wise, either due to autism or not. Some kids just have some sensory sensitivities. Now, this doesn't end in childhood, so this continues as an adult. So we want to test those out. We do a sensory profile to really kind of understand their sensory system. We do a higher order sensory testing, so looking at things like 2-point discrimination and sensory discrimination in general, temperature regulation, graphesthesia, stereognosis. These are all tests that a physical therapist or an occupational therapist might do to understand that person's specific sensory system. And then I would say, and again, this is not my area of expertise, this is an area I'm diving into and learning though, is to do measures of sensory integration and sensory processing. So again, to answer your question, what should I do next for my functional seizures, is you would want to work with somebody to test all of those things out. You can't test sensation on yourself. It's a funky and cool thing with the brain, just like you can't tickle yourself, right? So you would look for a physical therapist or an occupational therapist that knows and understands these higher order sensory tests and can do this with you to understand your sensory system. Now, there are some things that you can do for yourself. So there's some sensory checklists. So if you go to the Spiral Foundation, it's a really great foundation. They have great resources. So if you go there, you can look for a sensory checklist. And essentially in the checklist, you can look at what things in your sensory system are activating and what things are soothing. And oftentimes when we think of intermittent symptoms, sometimes you're trying to figure out, well, what caused it like right before? And honestly, it's not usually a right before thing unless you were like, I don't know, I was thinking you're at a concert and you've got like bright flashing lights and that is what caused it. But honestly, and in most cases that I see with functional seizures, it's an accumulation of inputs and nervous system regulation throughout the entire day. So this is where that sensory checklist comes in handy, is you can actually look at what is my day made of and how can I bring more regulation to my nervous system, because this is going to be what can decrease the functional seizures. So autonomic nervous system and the sensory system, often overlooked. It doesn't mean that there aren't other pieces. Lifestyle. So this is your sleep, really huge factor in nervous system regulation. This is stress management. This is your overall energy and pacing through the day. This is your diet as part of that kind of energy and pacing through the day. All of these lifestyle factors go into our nervous system regulation. and functional seizures. Psychosocial pieces definitely do. What are our stressors during the day? What are we noticing inside of our body? So interoceptively, are we able to tune in? Are we able to notice sensations from inside our body, our emotional world as well? Because again, all of these build into nervous system regulation. So it's not that those aren't important. I just find that the sensory and autonomic are more likely to be overlooked. So I'm gonna grab a couple comments in here, and then I want to jump into this research paper. So Sunbeams and Barefoot. Oh my gosh, I love that name. I often notice that a functional seizures happen around the time of hormonal change. Yes, so we absolutely see that as well. Around hormonal changes, even around changes in weather and seasonal atmospheric pressure changes, things like that, we can see functional seizure frequency change. It doesn't mean it will always be like that. So it means that for you and your brain and your body, the hormonal changes are kind of contributing to the overall nervous system regulation. And it may mean that you need extra of something else during particular changes. So you might need more sensory and autonomic regulation. So she said it would be wonderful to see studies on that. So I don't know if there is. I will say there are studies in other disorders. So migraine is not a functional neurologic disorder, but there's some similarities in nervous system regulation, right? And there are studies in the hormonal pieces. And I wouldn't do a direct kind of correlation there, but I might extract some things from those studies that would be really important to understand. Samantha is saying, I'm having a brief discussion with my PT and asking them pointed questions about their experience and what you need from that specific provider. I'm so glad, Samantha, because I think we all should be really great consumers of healthcare and ask pointed questions. Do they work? With the autonomic nervous system, the sensory system, how do they test it? How do they treat it? And I actually did a webinar last week with FND Hope, a really great resource for folks with FND. And we talked about questions you can ask your PT. So thank you for asking about that, or for saying that, Samantha. Somebody else is saying, Alicia, my seizures were triggered by complex PTSD. Body is not fight or flight. It just hits itself. I'm sorry to laugh at that, but I just love how you said that. I can hear what's going on around me, just can't control the body. It's such a common description of what can occur in a functional seizure. And you're recognizing, which is so insightful, that they might be connected to a really complex PTSD, and that shows up in the literature as a potential cause of functional seizures. And what I will tell you there as well, even when a functional seizure has its root in a traumatic history, PTSD, the body shuts down. It's a very protective mechanism. And the sensory and autonomic components of treatment can really be a doorway into finding nervous system regulation. So I just want to encourage that for you and for everybody. I think I went to therapy today myself. I literally do not go a week without working with a psychologist myself. It's how I make it through the week. So I'm just going to be really honest here. And I think working with a really skilled psychologist when you're having functional seizures that are connected with a traumatic injury or past event or PTSD is really helpful. And body-based activities are also helpful. sensory, and autonomic as well. And Samantha's just saying she's having similar experiences as well with functional seizures. And actually, I'm just going to say thank you for sharing your experiences, because you'll hear in these comments that you're not alone. Those experiences that you have in a functional seizure are really common. And thank you so much for sharing that personally. I find it so helpful to know that I'm not alone when I'm experiencing really uncontrolled symptoms or things that are not well understood. So with that, I want to jump into this article. So I shared this article in a post earlier, and I will, put a link to the article. It is, I think this one is free, full text. I read a lot of articles today, but I'll put it in our newsletter. Our newsletter comes out every Friday for clinicians and every Monday for patients and their families. And if you comment on that post from today newsletter, I'll actually send you the link so you can sign up. You'll get this video and you'll get all the links and resources and all of the things that we share every week. I also, before I dive into this, so I'll share this article, but our team is doing a free course for people with FND, and it's just in a couple of weeks. It's on February 22nd, so that's a week from Thursday. You can sign up on our website at reactivept.com/FND. We are so excited to share a lot of the research and our framework for people with FND. So let's dive into this article now. So this article was from 2022 in the, it's called Seizure, the European Journal of Epilepsy, and it's called Sense of Control, Selective Attention, and Cognitive Inhibition in Pediatric Functional Seizures, a prospective case-controlled trial. The first author is Lindsay Stager, if I'm saying her name right. Last author is Erin Fobian, who I had the great privilege of seeing talk at the last FND Society meeting, and they're from University of Alabama. So this is a group of folks that has done a lot of research in functional seizures, especially in kiddos. I think that we can extrapolate some of these things to all ages, but this study was just done in kids. And let me tell you, they were kids 13 to 18 years old, which is probably the most common age that we even see at Reactive with functional seizures, though we see a lot of adults as well. So they included kids 13 to 18 years old with functional seizures and compared them to, they matched them to controls. And in fact, they matched them to controls on every level, age, sex, economic status, you name them, they matched them. And they did a really cool task. So I have to read you about the task that they did because I thought it was pretty cool. So let me get this in here. So what they were looking at was to see what a group of kids with functional seizures, could they measure their sense of control? Now, they also were looking at selective attention and cognitive inhibition, but this sense of control is what I was most interested in this study, but I think all of it is interesting. But I was interested in this because absolutely, as you all said in the comments, and what I see clinically is when people have a functional seizure, they have zero control. Zero sense of control, no voluntary way to control it from happening once it has started. And so they wanted to measure this sense of control. And I'll put this in a little more context. The presentation that I'm doing this week at CSM for my fellow physical therapist colleagues, we're talking about what types of interventions build a sense of control for people. So if you're experiencing symptoms that are completely out of your control and you have no sense of control, it makes a lot of sense that your treatment would build a sense of control. And so that's why I was so interested in this study. And I actually am citing this study in our presentation this week. So they took kids, and I'm trying to remember how many they actually got, but I'll get to that. And then they matched them to controls. So then they had them do this cool game to measure their sense of control. And it was a video game. What I imagine, they describe it as like they have a mouse or a cursor moving, I think it's a little track at the bottom to catch falling falling X's that were coming down. So they had to catch the X's and miss the O's. So this reminds me of like my early video games. So I was like, fun. Okay, this is cool. So they have this video game. So in the game part, they're catching and they're missing the other ones. Then what they do is they have them judge how much control they had of the cursor. And the thing is, they actually put the cursor, because it was a computer, under different conditions where the child did not have as much control. So one of the conditions, I think it was called turbulence. Yes. And this actually made the cursor move even when they weren't moving it. This would drive me crazy, by the way. And then they had the magic condition. In the magic condition, they actually, the kiddo could kind of catch more X's, even if their cursor was a little off. So it kind of like widened the catch-all for the X's. So made it a little bit easier, but it changed the control. So bear with me. This is very typical in these like motor control experiments. They're kind of complex, and they're like, they're often kind of game oriented, and they're looking at like specifically how, in this case, the kids judged their level of control that they have. So what did they find? Oh, they had 52 participants, by the way. So 26 with functional seizures and 26 controls. That's not a bad amount, actually. Like if you think about it, I think that's a pretty good amount. It's still not a huge, large randomized controlled trial. But here's what they found. So I just want to go to, the kids with functional seizures had a much lower sense of control overall in the task. And they, by the way, nobody was having symptoms during this task. So it was not that they were having a functional seizure during the video game, but they experienced less control, and their perception of control in the conditions, the turbulence and magic, was also impaired. The other thing that I found really interesting in this, so I'm going to share this with a treatment sense, in a treatment sense, 98% of the patients had endorsed premonitory symptoms, meaning they had symptoms that they recognized prior to the functional seizure. So this was another thing that they were looking at. So let's start with that one, because I think that's so interesting. Oftentimes, I find when we start working with somebody with functional seizures, they don't recognize any premonitory symptom. This group did. And I think this is significant because I think for sure that is the first step of recognition for treatment. If you can recognize what that symptom before the onset is, let's address that. Let's give tools for that particular premonitory symptom. Can we bring in enough nervous system regulation then for the person, and they might not have a seizure? So this is very, I don't want to say, again, migraine is not a functional neurologic disorder, but similar, a lot of folks, by the way, with FND have migraines. So they kind of know, those things that come on beforehand. And if you can address those, so for example, I'll just give an example. My daughter has migraines. She will get some autonomic symptoms and actually some dysautonomia beforehand if she has salt, if she has electrolytes and a lot of water. She could actually prevent a migraine. Similarly, in a functional seizure. And as Sunbeam and Barefoot is saying, it took me about a year to figure out those symptoms. Amazing. Now I'm able to sit down at work before it happens. Yes. And so that is the very first step. I'm so excited for you because that means you've got one piece of control, right? One little piece. And when sense of control, which by the way is a very particular part of the brain and a brain circuitry issue, if you can just gain one little step of sense control, you're just one step there, one step closer, right? And so usually what we find is, okay, first we figure out what is that premonitory piece, and then often we'll actually see, gosh, there were probably a few things throughout the day. And then actually, instead of overflowing the river of nervous system regulation, we can add in things where that person has control and they have nervous system regulation. I was just talking to somebody today about this concept, and we were kind of going through the day. Symptoms are much worse in a high social situation like a party. And so lots of things happening at a party, sensory wise, autonomic wise, you're excited, all of those things. And so we talked, what could you do throughout the day? You want to go to the party. What could you do throughout the day to build in nervous system regulation? And what could you bring to the party? One of the things that's super regulating for this person are blowing bubbles. And she's like, I'm not going to blow bubbles at the party. And I was like, yeah, that might be kind of weird. Although, you know what? If you did that at a party with me, I think you'd be really cool. But she doesn't want to do that. So we actually practice multiple other ways where she could get that extended exhale, right? So we blew bubbles. We just blew out without the bubbles. We blew at a target, and then we imagined bubble blowing. And actually it was quite effective. So we'll see the next time she goes to a party. But what I'm really talking about is that it's not just what you do in that moment or that moment before. It's actually from the entire day and maybe even the whole week, right? So that could be a sleep piece. So it could be a lifestyle piece or a stress management piece. Or it could actually be a sensory and autonomic pieces throughout the day. So if you're already there and you've already recognized some of those premonitory symptoms, awesome. Then you might work back with your PT, with your OT, with your psychologist. What are the things that you can build into your day? One of the big pieces, so just to wrap up this study, again, this study found that sense of control, not just within the seizure state, but just within a motor control task, is impaired in a person with functional seizures. And this might really be a great place to step off into treatment. And I will tell you, one of my favorite studies that this group did, I want to get the name of it, retraining and control therapy. It's called REACT, not related to reactive at all. REACT. They studied this as an intervention in kids with functional seizures. I think they should redo it in adults. Maybe they are. But you can hear retraining and control. They're retraining the nervous system and these patterns and restoring control for the person. What they do is really develop a plan with the person where they have more control. I think they also had, by the way, fabulous outcomes. I think they're listed here. I can't remember off the top of my head, but it was like 82%, I think, of the kiddos in the study were seizure free. So really excellent outcomes with this intervention. And it's based on this idea from understanding the pathophysiology that there is this inherent lack of self-agency, lack of control, and when we can restore it. They also talk in the discussion about training in the autonomic nervous system. When I read that, I was like, yes, because, you see and do, I say we do these things all of the time. The literature from a neuroscience perspective supports addressing the sensory and autonomic nervous system, but it just hasn't been studied in a big way. So we're really taking kind of neuroscience and applying it to practice. That's what we have to do without having a big study. And honestly, we probably won't have big studies in a disorder like FND that has so much heterogeneity. So I'm going to sign off here in just a moment. I just wanted to make sure that I got some of these questions. Alicia, did they also have ADHD, autism, OCD diagnosis? Really great question. They actually said this was a limitation to their study, is that they did not, well, I should say they did not assess whether the kiddos had ADHD. They did not have any psychiatric history, which I'm guessing if they had been diagnosed with OCD, that would have excluded them. They didn't exclude people who had depression or anxiety, but they did say a limitation in the study was not looking at ADHD, or they didn't mention autism, but that is a limitation. Absolutely. I think I would want to know that information because I see those so commonly in FND. So how often are people diagnosed with isolated FND? I love that question, Alicia. Or Alicia. I'm not sure how you pronounce your name. Either way, it's beautiful. But I don't think I've ever seen somebody with, quote, isolated FND, but honestly, we're humans. I don't have one diagnosis, right? I've never seen someone with FND and not something. I'm trying to think, like the most common things we see: migraine, pain, maybe a physical injury, anxiety, depression, just pulling through like loads of information in my mind of the most common things: hypermobility disorder, dysautonomia, dizziness, like maybe actually like a BPPV or a vestibular neuritis or something like that. So anyway, I don't know that I've seen it. Alicia, what a great question. And somebody else also saying, yeah, sitting down after starting those initial symptoms. And here's the thing. There are some things that are probably occurring before those initial symptoms, like aphasia for this person. And it may be needing to build up the interoceptive awareness, so that sensory awareness of what's happening inside the body, to be able to pick up what's occurring before you get to the aphasia. Yes, Alicia says, I can feel my seizures coming on and make sure I'm safe. I'm so glad before it fully takes hold. really great comments and questions. Oh, hey, Jess. She's asking, how would you suggest someone figure out the premonitory symptoms if they don't know? What strategies did they use to promote autonomy and control in the second study you reference? Ooh, Jess, I'm gonna have to do a whole nother live on React. Actually, I've done one before, so maybe I'll link to that in our newsletter because it's been a little while. But after I went to the FND Society meeting, I did one on their study. So stay tuned for that. So how would you suggest someone figure out their premonitory symptoms? To me, one of the best ways we have done this is, well, I'm going to give you two things. Interoception. So building an interoceptive awareness of the internal state of the body and the nervous system. So we might build up interoception through heart rate variability, biofeedback, for example. I love using the leaf for this. I work really closely with our OTs. This is not a specialty area of mine, and it does tend to be in a specialty area of OT to do a lot of interoceptive practices for this. So interoception, and the second is really looking at the sensory profile, sensory processing for this person. So that sensory checklist could be really useful. Jess, I know because you're in Brain Bites, we have this. So I would recommend, so all my clinicians out there, if you're in Brain Bites, we have this awesome segment from our OT colleagues at Mass General, and they walk through cases where they're doing these activities with people to really understand what their nervous system needs. And that is a way to explore and kind of find those premonitory pieces. Not everybody has them. So again, if you're a clinician, you're in Brain Bites, you're going to go to that OT sensory talk. It is phenomenal, and there's lots of resources with that. And a clinician, if you're not already in Brain Bites, get yourself on the wait list. So many great resources for you there. So I love this. So people are sharing, I often find a weird sensation in the back of my neck attached to the base of my head and a nauseous feeling. So that also gives me so many clues. Like my mind is already going, ooh, I wonder how your neck proprioception is. Oh, I wonder how your autonomic nervous system is because that nauseous feeling, right? So that little clue right there, we would kind of chase that because I think there's probably an autonomic, sensory, maybe proprioceptive piece contributing to your seizures. So wonderful comments, wonderful questions. As always, I want to thank the wonderful person who asked me this question about how we treat F&D, particularly seizures. And as always, I love just diving into the literature and sharing a little bit with you. So again, if you have F&D, join us next week. We're doing a free live masterclass for you. You can sign up on our website, reactivept.com/FND, and get on our newsletter. We'll send out this video. We'll send out the resources. And hey, I hope to see you next week in our class. Get to see you live and see your faces. So I hope to see you there and have a great night. Thanks.